Good morning, everybody. Welcome to this really cool event. My name is Paul LeBlanc. I'm the immediate past president of the board of directors of the ALS Society of BC. And this is the first time I've had a suit on since about March 5th. It's very exciting. I kind of felt like a country farmer this morning. It's like going into the back of the closet. Martha, where's my suit? Got to go to Susie's wedding. Haven't worn it in 5 years. But managed to find it, and no moth holes that I could find. I'm not going to steal anyone's thunder today, but this is a good news event, and good news is always welcome in a difficult time. Now, we are certainly very fortunate to be here in BC. There are places that are not far that would be much tougher to be in right now, but none specific that I'm going to mention, maybe like a neighbor to Canada, but I'm not going to mention any specific neighbors. I don't want to embarrass anyone. But we are, of course, super fortunate to be here in BC, but we'll take all the good news that we can get. So we're going to have a few speakers today. And of course, please remember to continue the outstanding job that everyone's doing at physical distancing already here today. We do want to thank the Honourable Minister Adrian Dix for attending today by video link. We know how busy your schedule is, Minister, and we're really grateful that you are here. I want to acknowledge the MLA Linda Reid from Richmond South Centre and MLA Jane Thornwhite of North Vancouver Seymour. Both have been supporters of the Centre of Excellence since the inception in 2018. Thank you very much. So let's get to work. I'm going to introduce the current president of the ALS Society of BC, Donna Bartel.
Well, we're finally here. I can't believe it. So welcome and thank you for attending today's exciting announcement. We, as in Wendy and her team, I'm using that the royal we, went to great lengths to ensure that we are in compliance with all of Dr. Bonnie Henry's COVID-19 safety guidelines, including keeping those here today physically distanced and allowing no more than 50 people to be present, and that's including the hotel staff. So thank you very much, Wendy and your team. The ALS Society of BC is a registered nonprofit charity providing support to ALS patients, their families, and their caregivers. We strive to ensure the best available quality of life for those living with ALS. The Society also supports the national research programs directed to finding the cause of and a cure for amyotrophic lateral sclerosis. We are grateful for the province of BC, who currently funds 4 programs to support people living with ALS. The Provincial Respiratory Outreach Program, the Technology for Independent Living Program, the Communications for Youth and Adults Program, and the Choice in Support of Independent Living Program. The ALS Clinic at Vancouver General Hospital was started in 1980 under the guidance of a UBC full-time physician scientist, Professor Emerit Dr. Andrew Eisen. He is here today. Andrew, could you please stand? Since Dr. Eisman's retirement from UBC in 2005, the ALS Clinic moved to the GF Strong Rehabilitation Centre and is funded through Vancouver Coastal Health. The clinic is being served by 4 part-time neurologists who, although supply excellent clinical care, they have been not able to maintain the prior international stature that the clinic previously enjoyed, nor have been able to continue to run the clinical trials and clinical research. And this has left the ALS community with little hope. To achieve this essential need, the ALS BC has on deposit over $1 million, and we are thrilled today to confirm a new partnership with the University of British Columbia Faculty of Medicine to recruit a full-time dedicated ALS clinician scientist. This person will champion and direct the provincial ALS clinic in patient care and clinical trials, so British Columbians living with ALS have the same, if not greater, opportunity to participate in clinical trials as do others in larger populated provinces. So today, I'm very happy to announce that we are launching our fundraising campaign with a goal to raise $5 million for this initiative. Thank you.
Thanks, Donna. Now please welcome Professor and Head of Neurology at University of British Columbia, Dr. John Stossel.
Thank you very much. I will be brief mainly because I'm unaccustomed to being out of shorts and a t-shirt in the last several weeks. This is indeed a good news event, but I don't think we should lose sight of what is driving it. That ALS is a terrible disease that cruelly robs people of their capacity for independent function. And for a variety of reasons, it is difficult to attract academic physicians to work in this area. Really, to move the field forward, we need committed clinician scientists. This partnership and generous support from the ALS Society of BC and from the province of British Columbia, thank you, Minister, and the partnership with UBC are a very important first step to move this forward in the right direction. So I want to thank you for your support and for being here today. Thanks very much.
Thanks, John. And now, please welcome someone we've gotten to know a little better over the last few months, the Minister of Health for the province of British Columbia, the Honourable Adrian Dix.
Thank you very much. Thank you for having me at this event today. I wanted to say that I'm here in Victoria on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. I want to give a shout out to my colleagues in the legislature, Jane Farnthwaite and Linda Reid, who we meet with now. We had a legislative session this week. We tend to interact virtually these days, but I wanted to both thank them for being there and thank them for all their work on behalf of their constituents. And I want to especially thank the ALS Society of BC and the extraordinary work you do every day. These have been hard times the last few months. They've genuinely been hard times for everybody. I think everyone's experienced a little bit what people who struggle with disease in general deal with every single day. And the existence of the pandemic has made it harder for people every single day. And what the ALS Society has done in BC over the past decades for people suffering from this terrible disease and it's all of its terrible and challenging consequences, it is, I think, worthy of so much support and recognition. I want to thank Wendy Toyer and her team for all their work. I want to thank Donna Bartel and everyone she represents, the whole volunteer base of the ALS Society of BC, which makes such a difference, Dr. Stossel, and all of those that have gone before him and who have worked in this area who've made such a big difference. We are, in fact, a little bit working on the shoulders of giants who've done extraordinary things in the past. And all I can say is to express my gratitude for that. You know, we have to do better. We have to always do better. This is my view in every area of healthcare, that especially for diseases that are with you and stay with you, we've got to do better in the everyday of it, as well as doing better in helping define more important medical interventions to help people. This means, and we've been working on this very closely, and we'll have things to announce fairly soon, I hope, access to the drugs necessary to help people address and deal with ALS. But it also means building something better for the future. The ALS Society has come up with an idea that I think its time has come. It probably came a while ago, but its time has come now. And that time, the idea is to develop in BC an ALS Center of Excellence. I am so inspired that the University of British Columbia, which is at the heart of medical education in BC and medical research in BC, is part of it. I'm proud that the ALS Society is part of it. The inspiring goal of raising $5 million to get this going in the next few years, to support people who are dealing with ALS, to support them in their lives, to support them in their treatment. We need a Center of Excellence for ALS in BC. And that's why I am proud to announce today that the province of British Columbia will be, as part of this effort to raise the $5 million, is contributing and has contributed. In fact, the check is not in the mail, the check has arrived. $1 million to support this campaign. Will there ever and to say, I think that this is a partnership that we have to continue on with, because I know that there's also all the capital and all that's necessary to build these sorts of things. But what's really important is the day-to-day care that's provided by healthcare workers, and doctors, and nurses, and family members, and all those associated with this. So all I want to say really is thank you to everyone involved. Thank you to the ALS Society. I think this is a new day and a new partnership. Your friends and supporters around BC are going to be called upon to raise a little bit of money, but I want you to know that anytime you need my help, I'll be right there with you as well. The government will be, and I know members of the legislature from all parties will be as well. So thank you. Congratulations. Let's go do it.
Okay, so this is, of course, amazing, but our work is not yet done. We are on a mission to raise $5 million. I'm going to ask Donna to give us a total update of where we are right now and to remind us of where we need to go. Yeah. We're just over $2 million. So from here, it's up to us, it's up to you, it's up to everyone to get us the rest of that way. We've made an important first step. We've got work to do. We're excited to do it. We have press kits available at the door as you leave. Donations towards the ALS Centre of Excellence can be made at alsbc.ca. We do have some refreshments, but just a reminder, stay 6 feet, 2 meters apart, and please wear the masks when you're not eating and drinking or when you're not speaking at a podium. And I will end today by saying something I hope Dr. Henry will not sue me. Please be kind, be calm, be safe, and hang in there, everyone. Thanks very much.